Hi all, in this class we are going to discuss the application of ultrasounds in obstetrics and gynecology. So this particular topic we have discussed already by some case study, but in order to give us in-depth knowledge on this particular topic, here I have taken this topic in today's class. Okay, let's have what is meant by obstetrics and gynecology before getting into the application of ultrasound in obstetrics and gynecology. So these two particular topic is very important because it's more concerned about female things. Okay, so the obstetrics is a field where you will be having the point of care which involves your childbirth or pregnancy and postpartum, and also like if you focused on gynecology is full and full, it's been focusing on reproductive health of one male, one female part. Okay, so this is the two difference between obstetrics and gynecology. So let's start with how it's been evolved when how the ultrasound is being very major role in case of these two important field in medical. So in 1960s and 1970s, these doctors, the obstetricians, first they use the ultrasound to diagnose the early intrauterine pregnancy, which is nothing but the embryo formed in fallopian tubes. That you can say early intrauterine pregnancy. It is very risk that it has to be identified at the early stage. Okay, so otherwise it will burst out the fallopian tube, that it will be very dangerous to the that particular female. So that particular stage, okay, the findings we can easily get by use of ultrasound. This is where the role of ultrasound is start to boom to uh, play very much a big role in place of in a field of obstetrics and gynecology. So let's see what are the other applications. Okay, so the obstetric this particular ultrasound, where when you are using for obstetric field, that ultrasound is called obstetric ultrasound, or you can also say prenatal ultrasound, because this is one such a beautiful device, or it's a non-invasive procedure that uses sound waves to create the images of developing of fetus, or you can see the embryos development in the uterus. So what is actually the principle of this ultrasound is that it will just pass the sound waves with the help of one probe. Inside you have the piezoelectric crystal. So that piezoelectric crystal start to produce the frequencies in the range of sound. That sound waves it's going inside to the area where that is the targeted area, which is nothing but uterus. So that inside you have your fetus, right? So based on that movement or something, it will reflect certain amount of frequency. Okay, so you have some kind of shift also because of the baby movement or something, or a different layer of tissues, because of the penetration property of the sound waves. It will get vary from one stage to another stage when it all the way pass through to the targeted area. That reflected frequency it's being will be connected, and it will be that is will be connected by the same probe. That further the same probe will convert this signal into equivalent intensity. So this intensity will be mapped in the form of image. Okay, so image, you know, it is a group of what pixel which carries the intensity. So if you will place this intensity in the respective pixels, at last you will get image as a whole. That is what how does the ultrasound is working. Okay, so abstractly ultrasound also having the same principle. So since it is a non-ionizing radiation, it's not harmful for that in that extreme. So we will highly recommend it for obstetric field, in order to monitor the pregnant woman and unborn babies. So what kind of application we can go with this obstetric ultrasound is that you can first confirm the pregnancy, where that is the baby embryo formed, whether currently it is been located in the uterus, or it has been misplaced in some way, some other place. So that like that we can confirm the pregnancy and we can track the pregnancy. It highly help in the way how the pregnancy progress has been is going on from stage 1 to stage 4. You have the different gestational stage, right, till delivery of baby. So these progress of gestational pregnancy at different gestational stage we can track with the help of this obstetric ultrasound. And we have diagnosing the fetal anomaly. That means that anomaly is nothing but the feature of the fetal. Okay, that is that if you can have any like what like any malfunctionality or abnormalities you can see in the fetus, that we can easily identify or diagnose with the help of this particular ultrasound. And even you can monitor the blood flow. We can easily evaluate what is the blood flow we have in the umbilical cord or placenta or fetus. Okay, and we have also this applications in guiding procedures. That is like since we can have some kind of process or procedures like aminocentesis or plasmapherecomsynthesis, where you need a guiding procedure to send the catheter inside the inside your body. So for guiding procedure also you can go with the help of ultrasound. So these are the area. It covers the major role of application of ultrasound in